Hi, I'm Dr. Aldine Zeno. I don't know if you've heard about this, but we got to talk about it. I'm a urogynecologist, and if you're not aware, Brooke Shields talked about this earlier this year and also has discussed in her book that she underwent an unrelated surgery. And at the same time, the doctor just decided, why not do a little touch up and do a little labial reduction at the same time? What's wrong with that? That's actually battery. When you're doing surgery that is not consented for with the patient, then that is actually assault and battery. And physicians should be called out for that, absolutely, and punished accordingly. Now, this hurts us in two ways. Obviously, this hurt her and is illegal and just should not happen. But also, it hurts our specialty because there are people who are very deserving of and need procedures that are not considered cosmetic, that are medically indicated for things like prolapse, like labial hypertrophy, where we might perform a labial reduction with the patient's consent. And this gives the perception that these procedures are cosmetic and that they are, just for exactly cosmetic, like they're for appearances or they're not medically necessary. For patients, that gives the perception that these types of procedures are not going to be covered by insurance, which is not true. Conditions like prolapse, labial hypertrophy, incontinence, they are treatable and covered through insurance. Second of all, for people that are seeking these services, they're unaware that there are professionals who are fellowship trained in these procedures, and that matters because the extra training gives us special skills and usually the impetus to do them in a more ethical way. So I feel for Brooke, but I'm so glad that she shared this experience. And it's important to me as a urogynecologist that we get the word out about our services and what we can do for people, and that we call out these people that absolutely should not be doing this type of thing.